Hi students, welcome to the next session in oral pathology. I'm Dr. Gopi Krishnan. We are discussing oral pathology. In this video, we are going to start with our odontogenic lesions actually. So odontogenic lesions, before we go into odontogenic lesions, we should know the latest classification of odontogenic cyst and tumors. WHO, World Health Organization, is revising the classifications. Okay, from 1971, then came the 2005 classification, then 2017 classification, and latest it is 2022. Okay, so now the latest WHO classification for odontogenic cyst and tumors, we follow WHO 2022 classification. Okay, we are following 2022 WHO classification. So there is so many questions they ask regarding the classification. They ask regarding the odontogenic tumors. Okay, in INI-CET and NEET question papers, I have seen many questions which they have asked from the recent and 2017 WHO. Okay, so we will discuss the tumors, which all the tumors are there in the classification in according to WHO 2022, and what was added new in 2022 and what was added in 2017. Okay, at least you should remember these. So let's see the odontogenic tumors. So if you know the odontogenic tumors, there are many tumors. Main one is your ameloblastoma. Okay, the ameloblastoma, your conventional ameloblastoma, that is your solid ameloblastoma. That is the main one. The solid ameloblastoma, conventional, or we say it is multicystic ameloblastoma. Then comes your unicystic ameloblastoma and your peripheral ameloblastoma. These three are there from the previous classification itself. So ameloblastoma can be conventional, which is multicystic. Then comes unicystic ameloblastoma, and then comes your peripheral ameloblastoma. This ameloblastoma which comes in the gingiva. Okay, these three were there from the previous one itself. Now the latest introduction in 2022 is the adenoid ameloblastoma. This was introduced in 2022 WHO classification. So please note, they can ask you a question that which entity was introduced in WHO 2022, that is adenoid ameloblastoma. Okay, adenoid ameloblastoma. The other tumors which were there is adenomatoid odontogenic tumor, it's AOT, the squamous odontogenic tumor, and CEOT, calcifying epithelial odontogenic tumor, or the Pinborg tumor. Okay, these were there from the previous entities itself, and one was a metastasizing ameloblastoma. So metastasizing ameloblastoma, don't confuse by the term metastasizing. Okay, metastasizing ameloblastoma is actually a benign entity. There is so many questions regarding the metastasizing ameloblastoma and ameloblastic carcinoma. Ameloblastoma is a benign tumor. Okay, metastasizing ameloblastoma is also a benign tumor, even if it metastasizes to the lung. Okay, the concept is very clear. Please listen. Ameloblastoma is a benign tumor. Sometimes this ameloblastoma which is coming in the jaw, they can go to the lungs. Okay, they can go to the lungs. They can get spread to the lungs. But if you take the biopsy from the jaw and the biopsy from the lung, in both places, the histology will be very benign. Okay, you will see that the tissue, the biopsy tissue, that will show benign features, not any high carcinoma features. Carcinoma features, necrosis, high NC ratio, high pleomorphism. Okay, these are all features of malignancy. Okay, malignancy. The metastasizing ameloblastoma is just the presence of ameloblastoma in a different site, okay, in the lung, but the features, histological features, will be benign. The malignant ameloblastoma is ameloblastic carcinoma, not metastasizing ameloblastoma. The exact carcinoma, exact malignancy of ameloblastoma is ameloblastic carcinoma. Okay, so metastasizing ameloblastoma is benign. Okay, so that is one thing you should remember. Now next, see the next one, those benign mixed epithelial mesenchymal tumors. So first one was benign epithelial tumors. Now the mixed epithelial benign tumors, there is odontoma. There is complex and compound odontoma. The primordial odontogenic tumor, this primordial odontogenic tumor was introduced in 2017 WHO classification. Okay, please note, primordial odontogenic tumor was introduced in 2017 WHO. Then comes ameloblastic fibroma and your DGCT, dendrogenic Gosel tumor, DGCT. This was previously there. Okay, now coming to mesenchymal odontogenic tumors, we have odontogenic fibroma, cementoblastoma, cemento-ossifying fibroma, and odontogenic myxoma. Out of this, the cemento-ossifying fibroma was introduced in 2017 WHO classification. You know, cement-ossifying fibroma was previously it was considered as a fibro-osseous lesion. Fibro-osseous lesion. We will have a video on fibro-osseous lesion also. So cement-ossifying fibroma was previously considered a fibro-osseous lesion, which was taken from that, and in 2017 WHO has put for in here odontogenic tumors. So this is about odontogenic tumors. The odontogenic tumors arising from only odontogenic epithelium, that is your ameloblastoma, SOT, COT, etc. Then comes your mesenchymal tumors, both mesenchymal and epithelial, that is your odontoma, primordial odontogenic, fibroma, and DGCT. Out of this primordial odontogenic tumor, that was introduced in 2017. In mesenchymal tumors, cement-ossifying fibroma was introduced in 2017. So there were previous question in your INICT. Okay, the newer entity which was added in 2017 classification, the newer entity which was added in 2022 classification. Okay, so you should be remembering that. Now this is malignant odontogenic tumors. What are the malignant odontogenic tumors? Sclerosing carcinoma. So in malignant, you can see the term carcinoma. Carcinoma is the term used for malignancy. Out of this ameloblastic carcinoma, can you see this? This is the real carcinoma of ameloblastoma. Okay, so metastasizing ameloblastoma and ameloblastic carcinoma, please note, metastasizing ameloblastoma is a benign tumor. It's a benign tumor. It has just done a metastasis. Now you may doubt that metastasis is shown by carcinomas. Yes, you are true. Metastasis is a feature of carcinomas, but here in ameloblastoma, that is the exception. These are the concepts what they ask for exam. Okay, you should be clear with the concept. Ameloblastic carcinoma, if you have an ameloblastic carcinoma, if you take the biopsy, what you will see cytological features of carcinoma. Means there will be high NC ratio, there will be high pleomorphism, there will be necrosis. Okay, so these features of a carcinoma can be seen histologically. Okay, that is seen in ameloblastic carcinoma. Okay, what else? Clear cell carcinomas, ghost cell odontogenic carcinoma, primary intraosseous carcinoma, odontogenic carcinosarcomas, and odontogenic sarcomas. These are all, it was there previously also, there is no new addition. Now you come to the cyst. If you see the cyst being in the 2022 WHO classification, what you can see is that what are the cysts? Mostly your radicular cyst. Radicular cyst is the most common inflammatory. Okay, inflammatory odontogenic cyst. This is inflammatory collateral cyst. These are all inflammatory origin, and the others, you know, they are developmental. So the developmental odontogenic cyst, becomes the nasopalatine duct. Okay, nasopalatine is not an odontogenic, it's not an odontogenic one. Okay, and then comes your gingival cyst. Okay, this is a cyst of the head and neck region. The gingival cyst, dentigerous cyst, OKC, lateral and botryoid periodontal, COC, calcifying odontogenic cyst, glandular odontogenic cyst, and OKCs. Okay, so these are the very important cyst of the head and neck region. Okay, the other one which was introduced is a surgical ciliated cyst. Okay, that we will see. These are the this is the newest classification of WHO 2020. Hope you are familiar with the classification now. Now in the coming videos we will see this cyst. Okay, and what are the questions they usually ask from the cyst. Now why I put this small video, because they had asked questions from the classification. Okay, the entity which was introduced in 2020, so we should be updated. Okay, they are asking questions which are coming very recently. Okay, so thank you for listening this video. See you in the next video with a new topic. Thank you.